So
the sphenoid bone contacts all the other bones of the cranial cavity. So we can see it multiple places. On the side here, you can see sphenoid bone coming down here. This is sphenoid bone down here as well, because that's the pterygoid plates. When we look inside the orbit of the eye, which we'll do in lecture tomorrow, the back of the orbit is sphenoid bone, because the optic canal and the superior orbital fissure pass through the sphenoid bone. So we can see it from that view. A little more difficult to outline when we see it from the inferior view, but all of this that I'm touching here, all of this is sphenoid bone. Okay, so it's going to be temporal bone is here, occipital bone is here, this is sphenoid.
okay.
And here's like foramen ovale and foramen spinosum. Those are easier to pick out if we look at it from the front. Okay. So now when we turn it over and look at it from the interior view, we have the lesser wing of the sphenoid bone in contact with the frontal bone. And then down here, we have the greater wing. So you can see the suture here with the temporal bone. Okay? But all of this is the greater wing of the sphenoid bone. In between, but part of the greater wing, we have this depression here, which is the sella turcica. Okay? I'll go through the openings and I'll turn it over again and do the pterygoid. Well, I can do it now. So then I asked you to look at the pterygoid plates because I said we had 4 wings. So we have lesser and greater. And then we have the 2 lateral pterygoid plates. Some textbooks call them processes. 2 lateral pterygoid plates and the 2 medial pterygoid plates. Okay, so they form this border to the nasal cavity, the opening of the back of your nose. So now if we look back inside again, I'm going to put the pipe cleaner through this optic canal. And so that's coming out there, and then pointing with the stick would be the optic canal or optic foramen. And that contains the optic nerve. Okay. And that's the location. Notice how close that is to the sella turcica. So I said I have a pituitary tumor. The only problem, it's not metastatic, it's not going to spread anywhere, or drugs take care of the hormone problems. Wow. So the only problem is if it gets bigger, it could push up on the optic nerve and affect vision. Okay, I've had it for 22 years, so it's not doing that. All right, now if I pull this out, we're going to come back. So looking, I'm going to give you a view through the orbit. So there, the structures, the stick, and the pipe cleaner are in the optic canal. Okay?
That's the optic canal.
So they're in the optic canal with the optic nerve.
And with the optic, okay.
Now I'm going to put this in the superior orbital fissure, and that contains the first branch of the trigeminal nerve after it's passed through the supraorbital foramen. It also contains nerves that innervate muscles that move the eyeball.
That's the bigger hole.
That's the bigger irregular hole. So that now hidden, covered up kind of by the lesser wing, so superior orbital fissure.
Superior orbital fissure.
Then if we pull that out and that opening there, and I'll put this inside it on this side here, that is the foramen rotundum. Okay, so right there is foramen rotundum. And that contains the second branch of the trigeminal nerve, 5-2. And that's going to be coming in here through the infraorbital foramen, which we'll talk about tomorrow.
Okay.
And it passes through across this gap and then comes into the skull through the foramen rotundum. Okay. Then the third branch of the trigeminal nerve comes in through that opening there, which is the foramen ovale.
Foramen ovale, okay.
And the tiny opening just behind that is the foramen spinosum.
Can you get that? I want to get that one. It's a small hole.
So I'll put this in the hole.
Foramen spinosum.
Foramen spinosum.
Wow.
And that's for the middle meningeal artery. And that's this groove that you see coming up here. Is created by the branches of the artery when the bone was soft.
Okay.
And that's in the foramen spinosum.
Foramen spinosum. Okay.
Okay. So that's the sphenoid bone.
Okay.
And we'll do the ethmoid. So in the ethmoid bone, what's broken off right here is the perpendicular plate. So that structure right there is perpendicular plate, but part of it is broken. And then on the side, we have the middle and superior nasal conchae. Those are also broken off, but they would be on the side of the nasal
Superior,
cavity.
Okay. Superior and what?
Middle
Middle,
nasal
okay,
concha.
Okay.
And then here, we're looking into the ethmoid sinuses.
Ethmoid sinuses.
Okay. So it forms the medial wall of the cavity that the eyeball is in, the orbit. And then the perpendicular plate continues and extends up into the frontal, to the cranial cavity. So that's the cribriform plate, the Christa Galli.
Crystal Galli, okay.
And then on either side of it would be the cribriform plate.
Cribriform, okay. That's an easy identifier.
Okay? And that's
not too
ethmoid
bad.
bone.
And that's all still part of the ethmoid?
Uh-huh.
Okay.
It's also part of that bone. Okay?
Cool.
Want the occipital bone with the hypoglossal canal?
Why not?
Yeah.
So occipital bone with the external occipital protuberance, foramen magnum, occipital condyles, and then the hypoglossal canal is found there. And if we look at it on the inside, we have in a row here, here's internal auditory canal, jugular foramen, and then the hypoglossal canal.
Okay.
And then finally the foramen magnum. So those
Now-
are kind of all in a row.
On a test question, would you answer it either way? You'd flip it either way?
Yeah,
Like
you
put
could-
a visual up there and
Mhm.
say, what's A, what's B, or what's C? Okay. So you're not just going to ask it one way or the other?
Right,
or-
I
okay.
could show you both.
Okay,
Okay?
gotcha.
All right.
Cool, awesome.